Further signs and symptoms are dehydration and hypovolemia, which is low blood volume, potential reduction in muscle and nerve function due to reduced sodium and potassium, heart arrhythmias, nervous system changes, especially in the form of mood disorders, are common, craving for salt as seen in the case study in effort to replace the sodium being overexcreted in the urine, flimsy body hair, brittle nails, hyperpigmentation as identified in the case study, which is the darkening of the skin in places not necessarily exposed to the sun, like palms or in the cheeks. Normally, the anterior pituitary gland sends adrenocorticotropic hormone, also known as ACTH signal, to the adrenal gland, signaling to release glucocorticoids. Once there is an increase in the blood, the pituitary stops releasing ACTH. However, in Addison's, there are no cells to respond to ACTH, so the pituitary sends out more and more ACTH in an effort to get the adrenal gland to make glucocorticoids. Some of the ACTH that accumulates is turned into melanocytes that stimulate production of skin pigment. Intraoral hyperpigmentation is the initial sign. There is also blood abnormalities, hypoglycemia, hyponatremia, hyperkalemia, increased white blood cell count, acidosis due to an increase in hydrogen ions in the blood. Potential complications. Risk factors are comorbidities like type 1 diabetes, hypothyroidism, unmonitored or prolonged steroid use, and hypotension. Dysfunctional state of condition is hypotension, which can progress to vascular collapse and shock, Addisonian crisis, which is life-threatening symptoms that occur due to a lack of cortisol. They experience weakness and mental confusions, abnormal heart activity, fever and abdominal tenderness, sudden drop in blood pressure, convulsions, and coma. Treatment must be immediate and it usually involves cortisol injection and fluids to stabilize fluid and electrolyte balance. Lastly, as cortisol plays a role in mediating stress, people with Addison's need their holistic health to be monitored during these times of stress, as mental health can be affected. Many people with Addison's disease experience reduced motivation, behavioral disturbances, mood disorders, and even depression.